just wanted to start off by really letting you know what we've been able to accomplish last year in 2023. And thank you for all of your efforts. We really could not do what we were able to accomplish in 2023 without all of the work of the urban Indian organizations and the leadership. I also want to recognize Chelsea Gutierrez, Mary Jomia, and Rory Collins from our team as well, who are standing by and have also contributed to those successes. So thank you to all of those folks and all of the NCUIH staff who really are critical to pushing our efforts forward. We are going to need your voices again in 2024 as we look ahead and think about engaging on a federal level. We'll continue to talk to Rosalind So, Javier Becerra, and VA Secretary Dennis McDonough. And we are very pleased that we were able to visit many urban Indian organizations on the ground and hear what was happening directly from the leaders and the people from the UIOs. All of this has resulted in meaningful outcomes from the last year, and we'll be touching on that more. Once again, I just really wanted to say that we're proud of the advocacy and all of the work that you've put in. We're very lucky to have such good relationships with Capitol Hill, and we know that it's because you have spent so many years cultivating and building those relationships that we've been able to really gain some traction, specifically with, advance appropriations has paid off tenfold already. I will now pass it over to our Interim Director of Congressional Relations, Jeremy, to give a thorough recap, and looking forward to a great webinar today. Thanks all.
Thank you, Meredith. I want to take a few minutes before we get into our policy assessment review and our outlook for 2024 to just look at some of the goals that we set last year and the work that NCUIH engaged in 2023, which Meredith mentioned a little bit. So in 2023, we published our policy priorities document, which really hosts an extensive list of these priorities that we've had for both our congressional relations and our federal relations teams. These priorities are guides for our work throughout the year, and they help us set clear goals for 2023. Now, I wanted to highlight these top 5 priorities that we discussed in our webinar last year, which was increasing funding for Indian Health Service and the Urban Indian line item, establishing permanent 100% FMAP for Medicaid services provided at UIOs, increased behavioral health funding, securing advanced appropriations, and the reauthorization of SDPI. Now, I want to highlight first that, especially on our congressional relations team, our work really is focused on congressional sessions, which span 2 years. And so you'll see, as we talk about the priorities later on, some of them are still the same, as we are still advocating to achieve them within the congressional session. Now, in pursuit of these policy goals, I wanted to showcase just a fraction of the work that our policy team has been undertaking in partnership with UIOs and other organizations. We've published, well, actually one is going to be published soon, but we published 3 in-depth reports, one on 100% FMAP for UIOs and the successes of the authorization in certain states, a report on Indian managed care entities, and an upcoming report on traditional healing reimbursement. To achieve our goals, I want to mention that these reports really serve to both increase our own knowledge base, but as advocacy materials on the Hill and with the administration and federal agencies. In pursuit of this work, we have sent 29 letters to Congress, had 13 prep calls and focus groups with UIOs, submitted 19 comments to 14 federal agencies, probably over 80 meetings now with congressional leaders and staff, 5 congressional testimonies, 65 mentions of UIOs and legislation, and resulting in 17 bills being endorsed by NCUIH. And so this all serves to pursue the goals and the needs that our UIOs have and to address the needs of our urban American Indian and Alaska Native communities. As a result of all this work, we've had some significant policy achievements in 2023, despite it being a divided Congress. We were able to have the House and the Senate propose increases to appropriations for IHS and urban Indian health. Now, a full year appropriations funding hasn't been finalized yet, but in a year where Congress was really focused on reducing funding with COVID-19 rescissions, both the House and the Senate for their urban Indian health line item and IHS line item proposed increases. And so as we are in a continuing resolution right now, and hopefully a full year appropriations deal will be passed, we don't know what the final funding will be, but this gives us a strong foundation to ensure that our funding isn't cut and hopefully is increased. In the Fiscal Responsibility Act, which you might know as the debt ceiling bill, we were able to have the authority, the budgetary authority for advanced appropriations to be extended for advanced appropriations for IHS to be extended for fiscal year 25 and 26. That's really exciting, and that just needs to be completed. In appropriations bills. I think I saw a question just about the reports, I believe. Those reports are available on our website, and I'll have someone on our team be able to place the link to those in the chat. Continuing with some of the achievements, there was language requesting the administration establish a UIO interagency work group focused on addressing the needs of the urban Indian communities. That was included in the Senate Interior Appropriations Bill. We hope that that language will continue to be in the final appropriations bill and that the administration will pursue such a work group pursuant to the requests of Congress. We had the bipartisan introduction of the Urban Indian Health Parity Act in the House of Representatives on November 30th. This legislation is what provides permanent 100% FMAP for Medicaid services provided at UIOs. As Meredith mentioned, the VA Secretary, Dennis McDonough, he attended and presented at our conference. To my knowledge, that's the first time a cabinet secretary has appeared at an NCUIH conference, which we were very excited. We also had bipartisan support of 11 senators and 38 members of the House of Representatives on a letter requesting full funding as requested by the Tribal Budget Formulation Work Group for the Urban Indian Health line item in appropriations. This was an increase in 10 signees, and our goal this year is to continue to break that. And I think we want to get to like 65 members this year. That's our goal. Our NCUIH team presented our traditional healing report at the CMS Tribal Technical Advisory Group in July. IHS, SAMHSA, OASH, all hosted UIO listening sessions at the request of NCUIH. Our federal relations team did a great job in getting the president's budget request for urban Indian line item increased to 115. I believe this was a $2 or $3 million increase from last year. And then lastly, implementing the VA co-payment exemption for Indian veterans. And so quite a lot of achievements that we were able to achieve even in a divided Congress. We were very excited to see what the 2024 brings us and hopefully knock out some of our top priorities this year. Now I want to move to the policy assessment. So the policy assessment is comprised of information gathered from a series of focus groups that we held with UIOs. We analyzed the responses and feedback from UIOs to see what their successes have been, as well as the needs that they have for the coming years. This information is then used to also create the policy priorities document that I mentioned. So we have two documents, a policy assessment, as well as a policy priorities. Our participation this year in the focus groups is as follows. We had 11 full ambulatory UIOs, 2 limited ambulatory UIOs, 4 outreach and referral UIOs, and 1 outpatient and residential UIOs that all participated in this process. We held focus groups for each facility type, as often the challenges vary by the facility type, as well as a makeup session and individual sessions for any UIOs that were not able to attend the sessions at their time. And so all of these focus group sessions allowed us to determine the following findings from that process. So the first thing, and I think comes as no surprise, but funding remains a key focus and challenge for our UIOs and our programs. And with Congress focusing on cuts so much this year, we really focused our questions in the focus groups on what the impact of funding cuts would be. Now, there hasn't been any proposed funding cuts yet, but it's important for us to be proactive in ensuring that Congress recognizes that UIOs are already underfunded and need to be protected about that. And so we wanted to make sure that we understood the impact so that we could relay that danger to Congress. As you can see here, UIOs say funding cuts from Congress would be detrimental because they are already underfunded. Personnel is always the most expensive, and any cut would reduce their ability to serve. This next quote is, I think, one of my favorites because I think it really gets to the heart of the issue, which is that if you have funding cuts, it means rationing care, and delayed care is denied care. I think it's so critical for us to highlight to Congress, and I'm sure you'll see this in a testimony this year if you watch us testify, but we need to highlight to Congress that denying care doesn't just come in the form of saying no, but also in delaying any care that you can provide to your community. Because often when that happens, the impacts on an individual's health can be very significant. Now, this year was really an interesting opportunity for us because with the end of the PHE, it really highlighted the need for stable and consistent funding. And with the COVID-19 public health emergency, it really presented a case study of sorts of when there is increase in funding, what UIOs are able to do with that money. And so with that monetary support, UIOs were able to advance and grow their existing programs. They were able to onboard higher quality staff, double their workforce. Some UIOs were doubling their workforce due to this funding, but invest in infrastructure needs, establishing mobile clinics, expand dental health care, and engage in additional outreach efforts. And so UIOs being able to utilize these funds really shows that UIOs are a great example and great stewards of this funding. And we can show to Congress that increasing funding, as we are requesting the full funding amount, which the funding that UIOs are funded at is way below the full funding request by the Tribal Budget Formulation Work Group, that when UIOs are provided the funding, it does not result in waste or misuse, as many like to view government funding to, but rather a maximization of these funds to the benefit of their communities. Another key finding in the policy assessment is related to workforce retention and amongst a competitive job market. The healthcare industry as a whole really has been struggling with workforce recruitment, matching salaries in a rising competitive job market, and UIOs are no exception. I think tied with the challenge before around funding and being underfunded, providing competitive salaries can be difficult for many facilities. But UIOs don't have to just be concerned about providing competitive salaries in order to fulfill staff positions, because they also have to take into account that their staff need to be culturally competent as well. So, this is one quote from a UIO on this particular issue, but they said, we had applicants who are qualified, but they view natives as mystical beings. They have all these ideas of how they will fix the community. So having non-natives and people who are unwilling to listen to the needs of the community makes it very difficult. And so the UIOs are faced with this challenge of not only trying to find qualified and a staff that they're able to retain and afford to pay, but that they also need to be culturally competent. Another challenge, and we see this in different parts of the country, is the high cost of living. With UIOs being located in cities, some staff are having to commute, an hour, 2 hours, just so that they can live in an affordable place. Another challenge that was raised, and specifically around behavioral health staff, was due to the desire for remote work. Now, many UIOs are facing the issue where behavioral health staff would like to work fully remote. During the public health emergency, many staff went to fully remote practices. And now the problem arises is that many UIO patients want to receive these services in person. So it has been challenging for many UIOs to find behavioral health staff who are willing to provide these services in person, and in some cases in a hybrid situation. And lastly, UIOs, in trying to fulfill these workforce gaps, can utilize federal supported workforce programs like the IHS and HRSA's Loan Repayment Scholarship Program. However, several UIOs have been reporting difficulty leveraging the HRSA scholarship program due to lower than appropriate what's called the HPSA score, the Health Professional Shortage Area score. Bit of a technical aspect, but essentially HRSA requires a certain score to make a site be an approved site. Now, unfortunately, UIOs are receiving lower HPSA scores than are appropriate because HRSA calculates the score based off of the general data rather than data specific to the Indian healthcare system. So this is an issue definitely that our federal relations team has been working on and trying to address, because it really opens up the opportunities of where UIOs are able to receive, and provide benefits to professional and qualified staff. And I know I said HRSA, but I don't think I said out the full name, but that's the Health Resource and Services Administration. Moving on to health information technology modernization challenges. Currently, the primary, so health information technology are referred to as HIT, the HIT system. Currently, the primary HIT system for the Indian health system is called the Resource and Patient Management System, known as RPMS. This has been in use for nearly 40 years and has developed significant issues and deficiencies during that time, which has limited UIO's ability to utilize the system. Because of these issues, many UIOs have spent significant funds on money to better serve their UIO patient populations by purchasing commercial off-the-shelf electronic health record or EHR systems. This means, unfortunately, diverting a significant amount of funds that could be spent on other aspects of care just to replace a system that the federal government has a responsibility to provide. Now, regarding IHS's new EHR system rollout, there have been three kind of main challenges that were highlighted by UIOs. One, the need for technical assistance. Second, transition costs. And then third, the rollout schedule. And I really just want to take a little bit of time on the technical assistance and support aspect of this challenge, because several UIO leaders mentioned that their facilities often are last to receive technical assistance from IHS around IT issues. This is especially true in respect to the RPMS. As I mentioned, many UIOs feel like they're not getting the training or support required to properly understand, implement, and operate the system. And I want to highlight the importance of technical assistance with this one example. Now, this is not related to the system rollout, but rather to RPMS in general. But one UIO informed NCUIH that because of the lack of support from its area office, it was forced to hand count data to meet certain requirements and also have to hire an IT consultant, as this was a costly and avoidable, and unfortunately this is costly but avoidable expense. And so we really want to highlight these issues as important, that UIOs, as there's a transition, are receiving the technical assistance and support they need to be able to best serve their patients. Addressing issues related to missing and murdered Indigenous persons was also a top priority for UIOs. Now, the Congressional Research Service has found that a majority of missing and unidentified cases involving American Indian and Alaska Native persons occur off of tribal land. Unfortunately, American Indians and Alaska Natives generally do not have access to many federal programs and resources specifically designed to prevent violent crime against American Indians and Alaska Natives. However, several UIOs are already partners in combating crime and addressing violence in prevention in urban Native communities. Some of the stories that we heard was one UIO having a partnership with the Department of Justice to be a liaison with law enforcement on any local and missing Native person, as well as provide behavioral health services to any victim. Another UIO has been supporting individuals who've been trafficked and living in fraudulent substance use treatment centers by building a coalition to address and raise awareness on this issue. Additionally, our NCUIH board president, Sonia Technowski, is on the board, is on the Not Invisible Act Commission. They recently put out a report called Not One More. I'll ask one of our staff to also put that report or a link to our blog post around that so people can read more about it. But the report really focuses on the need for Congress and the Biden administration to take immediate action to address the related crises around MMIP and human trafficking of Indigenous persons. Despite the great work that UIOs are undertaking on this, there's still a need for increased urban Indian representation in these conversations and programs, as well as more support and resources from the federal government so that UIOs are able to expand or begin services to help fully serve those that are impacted by this crisis. Many of our UIOs are undertaking critical yet challenging work related to HIV prevention and treatment. In fact, I want to just quickly highlight that our Baltimore UIO, Native American Lifelines, will be hosting an event for National Native HIV/AIDS Awareness Day. So if you are in the area, would like to attend or support, after this webinar, please reach out. We'll happy to connect you and to highlight the work that they're doing. I think as is a common theme, during our focus group, it was repeatedly highlighted the need for increased resources for HIV prevention and treatment. This is especially concerning as this year there have been congressional proposals to cut nearly $500 million for HIV related programs across multiple programs, such as the Ryan White HIV/AIDS program, National Center for HIV, Viral Hepatitis, STD, and TB prevention at the CDC, as well as from the Minority HIV/AIDS Fund. And so this is critical for us to continue to advocate that we need more resources, and definitely we cannot be affording cuts. Another aspect of this was the need for culturally competent media materials that prevent transmission, as well as increased testing. As one UIO explained, there are not enough materials that are culturally competent, and it takes a lot of coordination and engagement with members that UIOs serve in order to get the messaging right that reflects the community. And also, there was just highlighted the need to increase research and data collection, as well as increasing behavioral health services for those that might be dealing with stigma and other issues related to a diagnosis. UIOs also emphasize that traditional healing is necessary to provide comprehensive health care to their patients. And consistent funding is important to ensure that these services, because these services are essential. UIOs fill a gap for many natives living in urban areas by providing culturally sensitive and community-focused care options. Now, funding was a recurring barrier to providing traditional healing. Most states do not allow for Medicaid CHIP reimbursement for traditional healing activities. This hinders the ability of most UIOs to meet the community demand for a more robust traditional healing program. This means that UIOs have to rely on often have to rely on private foundations and community partners to fund traditional healing practices. Beyond funding, UIOs report bureaucratic barriers to traditional healing. For example, one UIO reported that their local city officials was requiring their sweat lodge to go through significant red tape due to the city government denying permits to practice the full extent of their ceremony. There is also a clear expressed need for additional support and funding to address food insecurity in the urban and American Indian Alaska Native populations that our UIOs serve. Many UIOs operate programs to address food security and nutrition, such as food banks, meal services, community gardens, cultural cooking, and nutrition classes. UIOs do incorporate cultural knowledge into these offerings to help reinvigorate traditional practices in healthy eating and physical activity. I don't think will come as a surprise, but the need for these services really rose during the COVID-19 public health emergency. UIOs expanded their programs or developed new programs on food distribution and food pantries. One UIO shared that at the height of the pandemic, their clients or patients were more afraid of going hungry than getting COVID. And so despite these programs and services being very valuable, UIOs do not have enough funding to improve or expand on these services to promote the equitable access to food security programs that really is needed to address the high rates of food insecurity amongst the urban American Indian and Alaska Native populations. So many of these services, as they rely, as we've heard before, on private donations, community partners, it really is important that the federal government increases funding for programs and makes certain programs less restrictive to allow UIOs to receive and distribute food. And finally, one of our key priorities and information that we pulled from the policy assessment was during the focus group sessions was around housing being a really key focus of the conversation. Since 2015, there has been a 61% increase in unsheltered homelessness for American Indian and Alaska Native people. Many patients are struggling to find stable housing, and UIOs report that those experiencing behavioral health issues are amongst the highest rates of housing insecurity. To assist their patients, some UIOs provide full housing services, while others provide emergency temporary housing, but this often can be unsustainable. Housing assistance is usually outside the scope of practice for many UIOs, even though it is increasingly requested by patients. In addition to housing services, other forms of housing assistance are provided by UIOs, such as social and community services to those in their community. And so as we reflect on 2023, the challenges, looking ahead into 2024, we've begun to develop our policy priorities for 2024. And this list will help guide us through the year and set the goals for our advocacy. Now, I'm giving a preview of our top 5 policy priorities here, but when we publish soon our policy priorities document, that will have a much more extensive list, as well as our policy assessment should be published after this webinar. I just want to highlight again that we're seeing a continuation of some of these priorities from last year, as we're still in the same congressional section, but our federal relations team really is focusing this year and elevating the issue of reimbursement for traditional healing services. As I mentioned previously, one of our top priorities for this year, and I think every year, is to increase funding for the Indian Health Service and Urban Indian Health line item. We can jump to the next slide, Carrie. Currently, Congress, as I mentioned, is still negotiating a full year appropriations bill. On January 19, they extended the continuing resolution. They kept the tiered version, so part of the government expires on funding expires on March 8th, and the other on March 1st, and the other on March 8th. We're working to ensure that funding for IHS and Urban Indian Health is not cut and increased for the FY24 funding. But after, and hopefully, Congress is able to pass a full year appropriations by March, Congress will begin working on the FY25 appropriations. In order to secure increase in funding, we will engage on numerous actions with congressional and federal leaders to ensure this happens. We'll be sending letters with our request for full funding to appropriators. We develop letter templates and other advocacy materials for UIOs to send to their members of Congress, but also push out to our grassroots campaigns to elevate the issue and the importance of funding. We'll hopefully be testifying again this year to Congress during American Indian Alaska Native Public Witness Day about our funding needs, as well as we will, and you'll see with many of these priorities, continually meet with congressional members and offices to highlight this need and to ensure that our funding is protected. We also are working to secure 100% FMAP for UIOs. As I mentioned in one of our achievements of 2023, at the end of the year, we had the bipartisan introduction of the Urban Indian Health Parity Act, which guarantees 100% FMAP for medical services, Medicaid services provided at UIOs. We work directly with Rep. Ruiz's office in providing edits to the bill text, as well as helping them secure a Republican co-lead on this, Representative Don Bacon, and his first time joining in on this legislation. We're very excited about that. Going forward, we're meeting with congressional members, sending letters of support, requesting co-sponsorship for this bill to really increase its status in the House, as it's tough to move legislation. We also are working to try to have this legislation, either passed as a standalone bill or included in any public health extender bills that may happen, specifically working with the Senate on this, really exhausting any opportunity for us to achieve this critical piece of legislation that's important to our UIOs and their ability to provide care and receive funding in their communities. Another top priority is passing the Urban Indian Health Confer Act. Now, I mentioned this was passed in the Senate by unanimous consent. It is currently held at the desk or waiting consideration in the House. We are meeting with members of the House Natural Resources Committee, which is the committee that holds jurisdiction over this to work out any issues. We will be sending letters to representatives asking them to support and passage, and hopefully we can work with House leadership to bring this legislation to the floor for a vote and get this passed, as it has been a priority for several years. Last Congress, we were able to pass it in the House, but not in the Senate. So hopefully this year we can pass in both chambers. Next is the reauthorization of the special diabetes program for Indians. This was set to expire in September 30th. It's been temporarily extended with each continuing resolution, and most recently extended through March 8th at the current funding levels. We want this to be reauthorized at $250 million. That has been the request across Indian country over the past year. We met with a lot of congressional offices with this request. We want to support legislation that includes SDPI. And so there have been several pieces of legislation that have been introduced that will include reauthorization. Most notably is the Lower Cost, More Transparency Act, which passed in the House late last year. This includes reauthorization at $170 million. That legislation is still currently being considered by the Senate Finance Committee. I think they have some issues that they're working out, not related to SDPI. But then also, NCUIH will continue to serve as a technical advisor on the Tribal Leaders Diabetes Committee. And lastly, here is the reimbursement for traditional healing services. 4 states have submitted traditional healing reimbursement proposals to CMS. Of those states is Arizona, California, Oregon, and New Mexico. Arizona was the first state to submit an application to CMS way back in 2016. Should it be approved, we're hoping that the Arizona waiver will lay the foundation for the remaining states and hopefully set the stage for other states who might be interested in this. According to recent conversations NCUIH's had with CMS, it's still under review with the Office of General Counsel. As I mentioned, we will be publishing a report that really goes into much more detail around the issue of reimbursement, the value that traditional healing brings to UIOs and the needs and challenges that they have. NCUIH will continue to represent UIOs on calls with CMS, as well as participate in the CMS Tribal Technical Advisory Group and Medicare and Medicaid Policy Committee.